ahead and turn it over to our moderator tonight, Jennifer Caban.
Hello and good evening, friends. A humble thank you for all those who are able to join this evening. Your time is precious and valued, and we have a profound appreciation for our providers and those supporting our ECE field. Your ability to stay fluid in all of this while caring for our youngest learners is just invaluable, and we just can't thank you enough. So I want to first and foremost thank you for your time. Let's get into some fun stuff. Welcome to the Alameda County Public Health Department update, COVID-19 vaccines, brought to you by the Alameda County Emergency Child Care Response Team. Just a reminder of who the team includes. That is our local R&Rs, that is 4Cs, Bananas, and Hively. First 5, Alameda County Office of Education, Alameda County Public Health, and last but certainly not least, Alameda County Social Services, both the ECE program and the Office of Policy. Some of you may already know me. My name is Jennifer Caban. I am a management analyst at SSA, and this evening I will serve as your moderator. Before we dive into content, which Lisa will explain, and I'll formally introduce her shortly, I want to provide you some context and general information of how tonight will flow. So next slide, Rona. So Lisa will be, who I'm again introducing shortly, will provide us with a county public health update that will cover vaccines and access. Please note that this is a rapidly evolving subject and relies on federal and state guidance. Know that we are sharing the most up-to-date information that we have access to at this very moment. After her presentation, we will go into a Q&A session. Once you registered, you were able to share questions that you might have had. We've taken those. Lisa will try to answer those with the information she has available. Please know that you are still able to submit questions in the Q&A box below. We'll try to answer in real time, and all the questions that we are not able to get to this evening, we will be following up with an FAQ to answer those questions, and that will also come in translation English, Spanish, and Chinese. Once we do that, we'll just conclude with a few resources and next steps for you to note. Next slide. So I have the privilege to introduce Lisa Erickson, who currently serves as a school and child care liaison with Alameda County Healthcare Services Agency. You're going to hear Alameda County a lot, just in case you didn't know where you were. She's helping with schools, child care, sports, anything child care related, and COVID-19. She's your person. She's been a huge champion for our field throughout this pandemic, and we're really fortunate to have her here to support and advocate for us during this time. Without further ado, I'm just going to pass the baton over to Lisa to lead us through this content. Lisa.
Thank you for that introduction, Jen. And I just want to thank all of you for having me here tonight. It's a privilege to be able to work with you all and provide this information. I also want to echo what Jen said about you have all been in this since March, and we just really appreciate you. And it's just a real pleasure to be able to do these webinars with you and talk with you on a weekly basis, on a daily basis sometimes, when you all have questions. Next slide. Oh, actually, before I go to the next slide, just want to give you a quick overview of what we're going to talk about. We're just going to do a high-level overview, kind of a vaccine 101. And then I'm going to talk a little bit about planning, and hopefully we'll be able to answer some of your questions. But as Jen said, you may still leave with some questions unanswered, because we are, rapidly planning. Things are changing daily. So yeah, and we'll talk more about that as we get into it. Thanks. Next slide. All right, so just starting into vaccines, how do they work? Or this slide is basically saying that they do work. And this shows you the bubbles here on the left. It's then, so that's like what it would look like without the vaccine. You can see that for the measles, then it was 530,217, and now it would be 61 measles cases. So this just gives you a visual representation of these different diseases and what it looks like with vaccines. I think many of us take for granted what the vaccine has done for our world, but it really has changed the way that we eat, the way that we live. Next slide, please. So how do they work? So the way vaccines work is they teach your body how to fight a specific disease by creating a mild infection within your body. So your body's immune system fights that infection by creating antibodies, and then those antibodies will then fight that future illness when it enters into your body. And some vaccines require multiple doses and boosters to get that strong immune response. And some of the traditional vaccines that we're more familiar with usually use like a modified version of the virus or a bacteria that would cause that small illness. But what the COVID-19 vaccines are called mRNA vaccines, and those work a little differently. So I'm going to describe how those work. And they make a harmless protein that lasts in your body for less than a day. Next slide, please. All right, so there's going to be kind of a lot of big words on this slide, and I'm also learning this, everything about vaccines as you were all learning all this. I'm not a doctor, so I'm just going to be sharing with you a little bit about what we've learned around, what I've learned about the mRNA vaccines. So, let's see, the M in the mRNA stands for messenger, so they're messenger vaccines, and they're relatively new technology. And what they do is they trigger an immune response. Many vaccines put a weakened, or as I mentioned, a germ into your bodies. That's not what the mRNA vaccines do. What they do is they teach your cells how to make a harmless piece of what they call a spike protein. So it makes a protein in your body, and then that protein is what fights the virus that causes COVID-19. So that protein serves as an antigen or a trigger that makes you have that immune response inside your body to fight the virus. So that's how it works. What it doesn't do, it does not affect or interact with your DNA. So this is kind of a myth that might be out there that people think that it will actually affect your DNA. It does not do that. And one advantage of the mRNA vaccines is that they are not produced using infectious antigens, similar to some of the other vaccines that I just mentioned. So you cannot get COVID-19 by getting this vaccine. And while there are no currently licensed vaccines using mRNA technology, this technology has been studied for decades in vaccine trials like influenza, Zika, rabies, and they've also used it for cancer research as well. So that's just a little bit about this mRNA. And again, the M stands for messenger. And there's some links here in some of these slides so you can learn more and read up more if you want to. Next slide, please. So we wanted to talk about how, because a lot of people have this question around how did this vaccine get out so quickly, right? Because it happened within less than a year, which seems like a miracle. So many people are wondering about this. So researchers were actually they used existing clinical trial networks that were already out there studying HIV treatments and other vaccines for other diseases. So there was already a lot of research underway for these vaccines. Another critical piece was that the US government and the vaccine manufacturers were already, while the trials were happening, they already had all the manufacturing developed. So they were working on all that manufacturing while the trials were happening. They're also faster to produce than traditional vaccines. And finally, which is kind of obvious, the FDA and the CDC really prioritize that authorization because of the pandemic that we're in, the emergency situation that we're in. Next slide, please. And this is just a little, I'm not going to go into too much detail here, but you'll have the slide so you can reference it if you need to. But just to let you know, around 43,000 volunteers participated in the Pfizer trial, and approximately 30,000 volunteers participated in the Moderna trial. So a lot of people in a pretty fairly diverse sample or size of population, ethnic distribution. Okay, next slide. So the vaccine clinical trial findings. So, and I'm sure a lot of you have already heard a lot of this information, but they were found to be effective. So there's a 95% efficacy. They do produce some side effects. So fever, headache, muscle aches, and sometimes there might be a little bit more of those side effects after the second dose. It's similar side effects that you might experience with other vaccines like shingles or the flu vaccine. But there's no significant safety concerns identified in the clinical trials. And people with history of anaphylactic shock to vaccines should not get the vaccine. So you definitely want to talk to your healthcare provider about that if you have that. And also, at least 8 weeks of safety data were gathered in the trials, and there were no unusual side effects. And typically, if you're going to have side effects from a vaccine, it would happen within that 8-week time period. Next slide, please. So how will the vaccines change the pandemic? If we really get a lot of people vaccinated, we can really see reduce the number of people with COVID, hopefully reduce the severity of the disease, reduce hospitalizations and deaths, and ultimately create this herd immunity. So trying to get as many people immune to the disease as possible. And then shorten the time of the length of the pandemic. So there's still more to learn about with these vaccines, but we do know that they're safe, and they're trying to get as much vaccine produced as possible as quickly as possible. And we're still at the very beginning. So even with the vaccine, we're going to have to continue to use all of the safety mitigation, all the safety measures that we've been doing since March, which would be the face coverings, the physical distancing, cohorting, everything that you all are doing in your childcare. We'll probably be doing that for quite some time, even with the vaccine. Next slide. So children in the vaccine. We often get this question, can children get it? When will it be available for children? So right now, the Pfizer and Moderna vaccines aren't authorized for children. Well, for Pfizer, it's 16 and up, and for Moderna, it's 18 and older. But they are running vaccine trials right now for children, and hopefully soon, the vaccine will be available for children. But as you know, the vaccine supply is very limited right now, even for adults. So probably won't be coming to children for quite some time. We want to make sure that we're getting all of the phases vaccinated right now that we're planning for. Next slide, please. And vaccine timing. We get this question a lot around how much time is in between the two vaccines. So for Pfizer, the first vaccine, when you get the first vaccine, they'll let you know what vaccine you got, and they'll tell you when your next vaccine appointment will be. So you should get that information when you get your first vaccine. For Pfizer, it's 21 days apart, and for Moderna, it's 28 days apart. And you cannot mix the vaccine. So if you get Pfizer, you need to stick with Pfizer, and the same with Moderna. And there is a little bit of leeway. You can be maybe 4 days earlier, you can get it for the two. But generally speaking, it's 21 days apart and then 28 days apart. Next slide, please. Another question that we get is, after having COVID, should I get the vaccine? So, and the experts say that yes, you should, because there's such severe health risks with COVID that you should actually get the COVID vaccine after you've had it. You would want to wait. You definitely don't want to do it while you're isolating with COVID and while you're sick. You would wait until you were feeling better. And if you had any of these treatments, like these monoclonal antibodies or convalescent plasma, you would want to talk to your healthcare provider before getting the vaccine. And lastly, the immunity can kind of behaves differently in different people. After you've had COVID, how long that immunity might last. But generally speaking, you could probably wait 90 days before getting the vaccine. And because we're in such short supply right now, you might wait a little bit of time before you go ahead and get that COVID vaccine after having COVID. Next slide. All right, so now I'm going to go into, and we'll take, I guess, questions at the end. I always want to like pause in between these slides to chat with people, but we need to move along. So now we're going to shift into talking about the vaccine planning, which I know that you all are very interested in. How are you going to get the vaccine and when, and all of these other questions. So let's move into planning. Next slide, please. So a little bit about how the vaccine priorities are developed. They start with the at the CDC, at the federal level. So the federal level, at the federal government sets the first kind of round of priorities. And then the state develops further priorities. And then those are shared with the local health departments, which is our, Alameda County Public Health Department. And then what we're working on is all of the distribution. So making sure that the vaccine goes out in an equitable way, that we do really targeted outreach to the people that need it most, and that we're, that we have a very kind of mixed distribution strategy. So there's different ways that the vaccine can go out into the community. So that's what we're working on at the Public Health Department. And that little red font, down there it says priorities change frequently. This is very true. Kind of everything for COVID policy. I've never worked in anything like this where things are really changing daily. I know that's been really challenging for you as providers. It's also challenging for us, but we're just doing our best to try to make the communication as clear as possible and to get the information out to you when things do change. All right, next slide. So this is just a little bit about the state and the framework. So they're still going with phase 1B, which I'll talk more about in a minute. And all of you are in phase 1B. That's what childcare providers and educators are part of phase 1B. But once phase 1B is going to be finished, they're going to actually move to an age prioritization. So it will no longer be based on essential workers or the industry or profession. It'll be an age-based process for prioritization. So that's eligibility. The state has contracted with Blue Shield to help them administer or get to allocate the vaccine, because it's such a big, there's 58 counties in California, and they have to get that vaccine out to all 58 counties. And they also need to be able to report data on all that vaccine that's allocated. So Blue Shield is helping the state with that. And then lastly, the state has been pretty clear about that they want this to have an equity focus. So they're actually going to be giving more vaccine to the counties that have more neighborhoods that have been disproportionately impacted by COVID. And so they also use what they call the Healthy Places Index. It's called HPI. And that's what the state looks at to kind of identify these neighborhoods. And so in Alameda County, we do have some neighborhoods that have been pretty heavily impacted. So hopefully that means we get more vaccine to help. Next slide, please. So as I mentioned, or did I mention? I don't know, but I'm sure you all know. Yesterday, the announcement went out that we are starting phase 1B. Yay, exciting. And that will start next week on February 8th. We're going to officially be starting that phase. And everyone that's in that phase is ages 65 and over, and all these essential workers, which education, childcare, emergency services, and food and agriculture. Next slide, please. So let's see. One thing to keep in mind is that the individuals in phase 1A will still continue to be vaccinated. There's still a lot of the healthcare providers. I think there's still about 45,000 that haven't been vaccinated yet. So that's one thing to keep in mind. I believe in Alameda County, we have about 145,000 medical professionals or healthcare providers, which is one reason why phase 1A took so long, and it's still taking a while. We're still vaccinating phase 1A. We will still need to be taking appointments for vaccines, so that those will still be required. And you are going to need to be able to attest that you meet your current eligibility requirements. So that would be for your age, it would be a driver's license to validate your age. If it's employment, then we're going to be working out what that verification might look like. It hasn't been confirmed yet, but we're like literally planning every day around this. So hopefully by next week, we'll have a little more information about what kind of verification that you might want to show for your employment. It could be like a letter from your employer, or possibly your childcare license, or something from the funder that gives you funding if you're license exempt. I mean, it could be lots of different things, but we'll be sure to communicate that with you when we have that all finalized. Let's see, next slide, please. And another thing to keep in mind is that we're all going to have to be really patient with this vaccine rollout, because there are lots of people in this tier. There's about 325,000 people just in phase 1B. And unfortunately, we're just not getting that level of vaccine. So we have to figure out a way to really prioritize and make this as equitable as possible. And it might get a little messy, and we do really need to be patient. And Michelle actually crunched these numbers for me, and it looks like that's about 24% of the Alameda County population. So it's a big chunk of people. So everyone just take deep breaths, and we'll have to be patient, including myself, because I really want everyone to get vaccinated too right away. Those who want the vaccine. All right, next slide, please. So another thing to know about vaccines is that there are lots of different places and ways that you might find out about it, about getting appointments, and different places to get the vaccine. Some of these places that we're working on at our department are what we call pods, and that stands for County Points of Distribution. And I don't know if you've heard, that was also in the announcement yesterday around the Coliseum. And I'll talk a little more about that in a minute, but that would be an example of a mass vaccination site. And we also have some smaller community-based pods. One that we're going to be starting, I believe it started today at Fremont High School, and that's still for phase 1A for the healthcare providers. And then you can also get the vaccine through your healthcare provider, similar to how you would your flu vaccine, right? Through Kaiser or Sutter or Stanford. And then lastly, how will you know when it's your turn? Or how do you find out about appointments? There's different ways you might find out about this information. Some will be maybe through your employer, could be through your medical insurance. Some is like what we're doing tonight, right? We're going to be working really closely with all of the partners that put together this webinar, the Emergency Childcare Planning Committee. Did I get that right? I always get that wrong. So we're going to be working really closely with these partners to make sure that we're, communicating with all of you, probably weekly, if not more, around what's happening with vaccines. And then we're also working with a lot of community groups and partners to make sure that we have trusted messengers out in the community to deliver this information in ways that the community understands. And I think I already mentioned that. Oh, and just your medical provider. All right, next slide. And this is just a little more, it's kind of a visual of everything that we're working on. The pods are up here. And this is for everything for Alameda County. And then we're also going to be working with the community clinics that are in neighborhoods. So they will also get some vaccine. So it's the pods that are going to be in the community and the megapods, as well as the community clinics. Oh, and I should also mention, right now we have two pods, one's at St. Rose and one's at Castro Valley Library. And they've been serving phase 1A, the healthcare workers. And then we're now piloting some of these pop-up kind of community pods to kind of figure out how they work at some of our fire stations. And then we have 5 community sites that are planned. And I'm going to talk about that in a minute. Next slide, please. So also very, very important is that, we really hold these values and principles really dear to the work that we're doing. We want to make sure that we're being as transparent and as accurate as possible in making these vaccine decisions. We do have a community advisory group that helps us, deal with all the issues and kind of and talk about equity and figure out who these trusted messengers are to deliver the information. But we really want to lead with equity and data, which is the race, ethnicity, geography, socioeconomic factors, and thinking about critical populations. Next slide, please. And speaking of, this is a map of Alameda County, and it shows the zip codes that are most impacted by COVID. that are disproportionately impacted. And so these are the places where we're probably going to put a lot of these community pods. And on the next slide, it tells you exactly which areas those are. Next slide. So these community pods will be in these neighborhoods: East Oakland, Fruitvale, Deep East Oakland, Ashland, Cherryland, South Hayward, and West Oakland. And as I mentioned, we had our first pod that's starting this week. And we're going to be probably getting all these other pods up and running over the next few weeks. Next slide, please. And also in that announcement yesterday, we talked about, and you might have heard it on the news, that the state of California is going to be partnering with FEMA, the Federal Emergency Management Agency, to launch this mega vaccination site at the Oakland Coliseum. So this is really exciting. It's actually going to be the state vaccine supply, so they're not going to be taking that supply from Alameda County, which is also great. So it means more vaccine for Alameda County. And this is expected to launch on February 16th. And this is going to be using a different, the state's notification and registration system. The link is not live yet to register, but we will let you know when it is. It's actually on our website, but it's not, it's just a kind of a dead link. It's not up yet, but we will be sure to let you know when this is ready to go. And that notification system is called My Turn. All right. Next slide. As I mentioned, supply is limited. And we're so let's see here. County, I want to make sure I didn't already say all this. So what might happen with the supply is that because it's limited within these community pods, we're probably going to be giving out invitations to certain populations at different times. So we might plan for more appointments for seniors, for example. And then we may reserve certain days for particular essential workers or for people just living in specific zip codes. So there's going to be different, very targeted outreach that we use in order to make sure that we're addressing the equity issues and serving the people that need the vaccine most. And we're going to be doing that through these county community pods. And again, it might take a while to get an appointment because there's hundreds of thousands of people. So we need to be patient. And again, obviously, you can continue to contact your health plan and the community health clinics as well. That's another option for people who are eligible to contact them. Okay, next slide. So this is specific to you all. How will early care and education providers sign up to be vaccinated? So I believe many of you have probably already signed up, but we have something on our website that I'm going to show you on the next slide, which there's these forms that you can complete. And if you fill out these forms, then we will have a list of everyone that's interested in getting vaccinated, and then we can share information when it's your turn. So that's one way that we can just tell you that it's your turn to get vaccinated, is if you fill out those forms. You also may receive emails from your employer when it's your turn to get vaccinated, or actually for appointments, or possibly your local resource and referral agency. So it's going to be important because we're going to probably be partnering with these partners in the community to send out invitations to certain groups of childcare providers. So it's going to be really important that you check your email frequently for notifications and updates, and that you're really connected. So like today for this webinar, for example, this is an example of being connected, getting this information, because there's ways that we're going to have to communicate with you, and it's probably going to be through email and these webinars, and lots of different ways. But try to stay connected, and then also continue to check your health plan too as well. Next slide, please. And this was our website. I do want to mention that there's a lot of information on our vaccine page of our website. So this is the address right here. These are the forms I was telling you about. So you can fill out the employer form or the resident form, either one. And it does have childcare as an option. And that way we can let you know when it's your turn. Unfortunately, it's not like a, what do you call it? You're not signing up to get a vaccine. It's not an appointment system, but it does kind of get you in our system, and then we can notify you when it's your turn. And then on the vaccine, our webpage, we have an entire section just dedicated to FAQs, frequently asked questions. That's really useful. And there is a Google Translate button that you can have all those questions translated for you. There's lots of questions on there. So I would highly recommend that you take a look at that. And there's just a lot of information about planning. So definitely visit the site, because we'll be updating it daily, probably, with more information. So I want you to have that. I think that's it. Did I get through it all?
You did.
Yeah.
Lots of information. I'll give you a second just to get a drink of water, because you shared tons of information
Okay.
with our community tonight. Like I mentioned, we're at the Q&A point. We have a few questions that were submitted, and so we want to do that with Lisa. I actually saw one of these questions pop up in the Q&A. And so the first question is, Lisa, how much does it cost to get vaccinated?
That's a good question. The vaccines are free, so they don't cost anything. They're free. Yeah.
Free.
Yay.
Free 99. We all love free.
Yeah.
So that's good to know that we won't have to worry about folks who are underinsured or not insured. The next question is there a specially designated location for child care providers and assistants to be vaccinated?
No, there isn't at this time. That could change in coming months, but at this time there won't be a designated pod, most likely, for childcare, at least in the short term.
Yes, and I will share that, the COVAX Community Advisory Group has been discussing about the accessibility of vaccines to childcare. So it's an open meeting that all folks can join and just pop in your questions or your thoughts in there, do some self-advocacy. So I put that in the chat box a little bit earlier, but they're on social media. So if you just look at Dare to Be Well, they give information on how to access. Next meeting will be next Tuesday at 6:30 p.m. Okay, let's pop into the next question is, when the COVID vaccine becomes available to childcare providers, will it also be available to those living in our homes?
Yeah, that's a good question. As I mentioned, we're still, confirming all of the definitions and priorities and everything, but most likely it will be the people that are, registered under your license to be working in your childcare, but it wouldn't necessarily be everyone in your household. Most likely.
Okay, so we just need more guidance on that. Thank you. I already had COVID. Do I still need to be vaccinated?
Yes, which is what I don't know if you remember the slide that I shared. You don't need to go out right away to get vaccinated, but they still do recommend that you would get vaccinated. But you have a little more time. You don't have to rush to get vaccinated. And definitely don't go out and get vaccinated while you're recovering from COVID.
Yeah, that'd be a lot for your body to handle.
Yeah, not good. Yeah.
I have one more question. I see there's a lot popping up, so we'll likely collect those and answer those in our FAQs. This next final question is, will license exempt providers, i.e. family, friend, and neighbor caretakers, be included in this defined group of childcare workers?
Yeah. So as I mentioned, we're going to be sharing the kind of final definitions probably next week or soon thereafter. But hopefully, I'm thinking that the license exempt providers would be included in childcare workers.
Thank you for that. Those are the questions that we have time for, Lisa, thank you so much, Lisa, for taking the time out to just share the information. I know that it's ever evolving, and you have just been great about taking questions and calls and all that good stuff. So we appreciate your partnership in this work.
Sure. I'm going to share my, can you share my email, the Safe Learning email too, with the group, just to make sure that they have it?
Thank you.
I can put that in the chat too.
That'd be great.
Okay.
Appreciate that.
Sure.
We'll go on to the next slide. So we're going to go into resources. Again, we're getting a little close on time. Want to make sure you have access to some information. And so funding has been a huge challenge for the field. The round 2 of grant funding for the California Small Business COVID-19 Relief Program has been reopened. It reopened this past Tuesday, Groundhog Day, actually. And so it provides you an opportunity to get $5,000 to $25,000, depending on your business receipts. If you apply during round 1, you don't need to reapply for round 2. You will automatically be transferred in for that. You can apply if you need the additional funding, you haven't already received this relief grant funding information, and there was something else that I wanted to do. And if you missed any information in your application, you know, sometimes you submit something and you're like, oh my God, I put the wrong thing, or I need to add the thing. There is a contact information for you to reach out to the state. It's best for you to do that instead of resubmitting. Resubmission of any applications will only slow down the process and slow down the ability for the money to get into your hands, which is where it's needed. Next slide, please. So this next slide has the where you can find it. It is at the carereliefgrant.com. It's a state website, from my understanding. It's translated into a number of different languages. So it's a little bit more easier for you to navigate if English is not your first language. Again, just to remind you, round 2 just opened on the 2nd. It will close on the 8th at 6 p.m. Pacific Standard Time. And then you have the additional information there. There is a list of partners on the website by county. So if you go to Alameda County, there will be local partners if you need some technical assistance in supporting this application process for submission. I think that's the most of it. There's an FAQ there. Again, the county partners will be able to help you if you need technical assistance, but please apply if you haven't already received funding. All right, next slide. And so we love to repeat. So the Alameda County Emergency Child Care Response Team is comprised with the R&R agencies. We have a communications team that we're really trying to align all the state, local resources, federal resources that we come across and message them out to childcare providers as quickly as we can, as uniformly as we can, so that you're getting and receiving the same message. Please stay connected to them. Please open their emails. They're sharing a lot of information. They've just been such an amazing partner to get out community supplies, to get out grant funding, just to be in communication with families and get them access to care during this COVID time, and even pre-COVID, but you know what I mean. Stay in contact with your local R&Rs. Next slide. And so we've been really working, we've had listening sessions last summer. We've done a few webinars in partnership with public health and other partners. And so we know that there still continues to be evolving information, particularly now that vaccines are out. What we want to try to offer is a COVID-19 child care check-in. So these will be more like information sessions where we'll share like the most relevant information that's available. That could be through public health. That could be with maybe some resources or funding that are available, just to keep you your tab on the pulse, if you will, of what's occurring. So what we know and what we have access to as a collective, we get to share that with you in real time. We'll have guest speakers. We want to piggyback on this session and have it on the first Thursday of every month, at least through June, at 6:30, same time, same bat channel. The information will come out through the R&Rs in the very near future. So we'll plan for the first session being Thursday, March 4th at 6:30. Next slide. And so I just want to say a humble thank you. Again, humble thank you to Lisa for, again, sharing the most real-time information and out to our most precious workforce here in this county. I know this has all been a lot for us. Please know that we're advocating and championing for you and your families and getting the supports that you need. We thank you for joining us this evening. The information, we hope this information was valuable. It will be made available to you, this webinar, in the languages made available this evening, along with the FAQs. Again, stay in contact with your local resource and referral agencies. We thank you. Until next time, stay strong, be safe, and stay healthy out there. We'll see you soon.